Hi, I'm Jo from CPAP Victoria. I'd like to show you how to set up your Fisher & Paykel Sleepstyle device to get ready for use. First of all, we'll just take the device out of the bag. All the components are in here. So that's your CPAP machine. Then we have the heated tubing. And lastly, the power supply. So turning the machine around the back, the power supply plug just goes into here. Now you can either have it in either direction depending on what might suit where your power point is. Just needs a firm press in. Alright, so I'll just turn it around and I'm just going to plug the other end into the power point. Secondly, we've got the heated tube, which is going to provide warmth to the airflow. So you've got an electrical connection on this end, and the other end is a simple plastic tube end, which will connect eventually into your mask. So this connection here, you turn it around the back, you just need to line up the electrical connection with the hole there and simply press it in. When you're removing the tube, you'll find that if you use this as a bit of a lever to remove it, so that you're not putting pressure on the tube itself, because it can get stretched and damaged. Once that is in, the tubing has the ability to rotate, so you're not restricted with your movement. Let's put the tube aside. I'd lastly like to show you around the back here. You've got a little air filter. So this is basically the air inlet for the device, and as the air flows in, the filter collects the dust. Now the filter itself is not washable, it's just removed as so for cleaning by just brushing your fingers over it, getting rid of the dust, and you'll notice that on one side there is a straight line and on the other side nothing. This side here is the line that goes in towards the machine because it is a layered filter and that's the direction it should go. I simply remember it by thinking, well, that's not very attractive to look at, so it goes inside the machine and it just sits in there. Just make sure you don't have this pushed really close to the wall so that there's a room there for the airflow. The plug kind of helps with that too. So the device itself is probably going to be sitting on your bedside table, and inside the machine, just by pressing here and lifting, you will find the humidifier chamber. This is where we're going to put water so that we provide you with warm, moist air. Now the type of water that we use in the chamber needs to be distilled water only, because it keeps the machine nice and clean and it keeps the chamber nice and clean. This is a chamber seal that sits on top to create the seal. So that's your tub, and it simply opens up like one of those Tupperware dishes, simply by pulling here and opening. So that's how you would clean it in warm soapy water. With the distilled water though, you just fill it up to the marked line, just below that marked line, and you'll find that the tub is shaped. So there's only one way that it can fit into the device. So if you try and put it in backwards, it simply won't go. You've got a rounded corner matching up with the rounded corner here. So you just lift it in and sit it down. The seal also has a rounded corner, so it simply shows that that sits just on top like that and flat. And to close it, you just need to press it firmly and you'll hear it click shut. To actually turn the device on, you've got the starting button here. So this is your start-stop button, and depending on how your machine is set, when you actually start it, it may be a high level pressure, and if you're not comfortable with that high level pressure, all you simply do is hold the button in for a few seconds and you should see a triangle appear on the screen and the pressure will drop down. That triangle just represents that it drops down, pressure starts low and then gradually rises to your therapy pressure. If at any stage during the night you're not comfortable with the therapy, you can hold that in again and just drop it back down. To stop the device altogether, it's simply a press button here. And that's how you activate and set up your device ready for use. One caution that you really need to take notice of is not to pick up the machine or move it once there is water in the device. It's just that the water can get into the motor itself and destroy the circuitry and disable a very expensive piece of equipment. So once the water's there, just leave it in position. If you need to move it, just take out the water tub. Hi, so I'd like to run through just how to care and clean your CPAP device, the Sleepstyle. Firstly, we just really use soap and water. Normal tap water is fine. The type of soap that you use can depend on whether you have sensitive skin. So with sensitive skin, you're probably better off using a pH balance product, such as Cetaphil or something similar that you can buy from the pharmacy. If you don't have sensitive skin, you can use just really whatever you normally use for washing, or you can simply use dishwashing liquid, but just making sure that you rinse it thoroughly after and get all the soap off. So first of all, the tubing. The tubing should be washed weekly. You just simply pull it to remove it using that lever there to help disengage it. It's quite safe to get the tubing connection wet, and so you have the option to either soak it in warm soapy water for 30 minutes and then just rinse it inside and out and simply hang it over the shower or towel rail. If you find there's some beading of moisture and it starts coming up into the mask after you've washed it, then you may like to take it off, give it a shake, plug it back on and just run the machine for a few minutes just to get out the last of those droplets. Okay. Right, some people actually prefer to wash their tubing in the shower, which is fine. Again, warm soapy water, just rinsing it through and hanging it up over the shower. If you're going to do that though, just make sure that you're safe and you're not going to slip, because safety always comes first. The water tub. So cleaning the water tub is simply a matter of opening this up and removing it. Removing the seal, opening the tub, and you just wash these parts in warm soapy water, rinse them in clear water, and then just leave them to air dry. Lastly, we have a filter, and the filter just needs to be removed once a week. So we'll turn it around the back. This is the filter here. It's not a washable filter because it's layered and it will destroy the layers. So just once a week, take it off, flick off the dust and pop it back in. There is a particular way that it sits inside the machine. You've got it marked on a line across here. That's the inside of the filter, and it just disappears in there so you can't see it. Can't see the line. So once a week with that, eventually if it's your own machine, you will need to replace the filter, and it may be at the 3-month mark or 6 months, just depends how dusty the environment is in which the machine's actually operating. If you're wanting to actually clean the device itself, just a damp cloth and you can just wipe over the surface. I'd just like to explain a little bit about the screen and what it can show on your Sleepstyle device. So initially, it shows everything that's actually connected to the device. So the symbol for the tubing is this round symbol here. So if I remove the tube, that will disappear off the screen. The second symbol is for the little USB, that's a recording device that's in the back of the machine. So if your USB stick is missing, that will disappear also. Let's get the back up on here. And these two symbols just represent, the first one is for the Bluetooth connection, because you can have an app on your phone that Bluetooths to the machine for the data to be sent through. And the last one is the modem, and that's how it operates to send the data through to us so we can help you with your therapy. There is further settings that you can access through the menu, however. To do that, pressing this button here will take you through to your humidity settings, and that's the most common thing that you might like to adjust early on in your use of therapy. The humidity is really the level at which it provides moisture and warmth to the airflow. The highlighted droplets just show that that's the setting. So here we've got 1, 2, 3, 4, 5 droplets up out of 7, so it's at a setting of 5. To increase that, it's simply the up button. To decrease it, it is this button here. And when the screen flashes, it just means the setting has taken. Eventually it will time out and go back to your start screen, but you can still start your pressure flow from this screen if you choose to. Another press of the menu button gives you to the next setting. Now this setting is called expiratory relief. Now your clinician may have set this for you to have access to or not. It's a setting where the pressure can back off when you breathe out. They will have set it for what they think is appropriate for you, but if you're having trouble with breathing out, they may suggest that you increase this setting simply again by the up and down arrows. Levels 1, 2 and 3, meaning level 1 is a small decrease when you breathe out, and level 2 is a large decrease, level 3 being the maximum for comfort. Again, menu button, and you get to the next setting, which you can access your summary data. Now, when you first start on therapy, you're not going to have a lot of data. This stands for day, week, month, but if you'd like to see what your results were for last night, you can simply access the daily data by pressing the button here, which will show you how many therapy hours you've done last night, and it will scroll through the mask leak, whether it's normal or high. And lastly, the AHI, that problematic breathing events number that you can compare with pre-treatment. It can scroll through quite quickly, but you can re-access it and just repeat that yourself if you like. So scrolling through, you can then hit the menu button and it scrolls through. If you're looking to look at weekly data, you can just move across to the weekly data and then access it in the same way. Moving down further takes you back to your home screen. So just to recap, you can access the menu data, you can move through the different screens, and you use these buttons to increase and decrease parameters, and when screens flash, it just means that the setting has been taken.